Hey, ladies and gentlemen. Oh, I can't believe what crazy times it is, right? Here, I wish I could be in the same room with you so I could be telling you about our program, get to show you our program, answer your questions. But okay, well, I'll get to see you at least. I'll get to interview you, I'll get to answer your questions, but we won't be in the same room. We'll have to deal. Let me give you the little speech that I would normally give if we were all sitting around a table together. I'll tell you a little bit about myself. So I'm Dr. Brian Greenwald. I'm the fellowship director here. I've been attending here for about, I guess it's coming up on 8 years as the medical director of the Center for Brain Injuries. For myself, I'm a Brooklyn boy. I grew up in Brooklyn. I did my schooling out at Stony Brook. I did my internship in California just to see what the other side of the world was all about. I did my residency in P&R over at Kessler. I did my fellowship training over at Virginia Commonwealth University. And then I've had a number of jobs since over at University Hospital in Newark. I worked also over at Mount Sinai for about 10 years in New York City. And then I've been here for about eight years. And the brain, what I love about being here and being in the brain injury program here at JFK is that really the brain injury at JFK, at the JFK Hackensack Meridian program, really the brain injury is their flagship program. You'll see a lot of the resources when you come here and a lot of the excitement that's here is around brain injury. We have other good programs, that's for sure, amputee and pain and spinal cord and all sorts of other good programs. But really, I think, brain injury's been around a long time and it's really their flagship program. So it's fun, honestly, to be the medical director of that program. That's for sure. It's an exciting time to be here at JFK also for a few reasons. One is Dr. Cucurella has done a great job in expanding our program greatly and hiring so many more attendings and really expanding all the things that we do. Brain injury has done really well. We've hired, I can't even remember how many attendings in brain injury now, and we keep hiring each year more really to look at different things, so many concussion issues and long-term care issues and aftercare issues and so many different things. Such a great opportunity to be here, and you can really feel that excitement. Our collaboration now with Hackensack Meridian, this big healthcare system around the state, has also offered us more resources and also made it that Dr. C has hired that many more people. Such an exciting opportunity with Hackensack Meridian having, I think, up to 20 hospitals now throughout the state. Although really, for rehabilitation, JFK is the flagship that way. Let's see, so we're an ACGME accredited program, like many of the programs that you're applying to. We got ACGME accredited. I think we're one of the first programs to become ACGME accredited. What I really liked is when I was writing out the application, I didn't like writing out the application to ACGME, but what I did like about the application to ACGME is that I really didn't have to change the program at all. Really, the program, with all the work that I had done and Dr. Cucurella had done over the years prior to that, we'd had it in a great position already. I guess the one thing that we changed, which you'll have a chance to see when you look at the schedule, your rotation schedule, is that we put a dedicated half-day research. So every week you have a dedicated half-day of research. Let's see, so here, let me just happen to pull up the Tracy Morgan magazine. This is one of the magazines from a few years ago. I believe that you're going to get a copy sent out to you if you haven't had a chance to take a look at it. Now, you might just say, like, oh, Greenwald, what is he? He's just up there trying to show off that we took care of Tracy Morgan. Actually, what I really like about that magazine is that, first of all, the pictures of me in there look fabulous. But second of all, it really shows off the continuum of care that we have here at JFK, and it talks about all the different programs. So if you want to learn, especially not having a chance to come and play with us here directly, if you want to learn about our program, I think there's a lot of nice articles in there that talk about, the trauma center and the good work that we do at the trauma center, both at Robert Wood and Jersey Shore and now up at Hackensack. Talks about the brain trauma unit, where we have our acute rehab setting, where we take care of patients with a variety of brain injury needs, traumatic brain injury, and we take care of some low-level patients, right? So we have a nice coma recovery program, and also some higher-level patients who have significant cognitive or behavioral issues. We have a secured unit, so you get to see really a great big spectrum of patients there on the brain trauma unit. we're lucky. We're really the only center in New Jersey to have what's a brain injury subacute rehabilitation setting. So we actually have what's called the Extended Recovery Unit, which Dr. Levine heads up, which for patients who aren't ready to go home after their stay in the brain trauma unit, they get to go over there and spend additional time. It's actually the only certified center in the state of New Jersey, and really one of the few places like that in the whole United States. Again, an important part of our continuum of care, our dedication to the care of persons with brain injury and getting them as well as possible to get them back to everything that they deserve. Of course, what we have next also as part of our continuum is our cognitive program, our outpatient program, which has a focus on getting people, back into the community, getting them, their continuing outpatient PT, OT, and speech and neuropsychology in a very integrated way, so that everybody works together closely. You have a chance to be involved with that also, but also a focus on vocational and educational needs. Again, getting people up to and back to everything that they deserve. And so this magazine featuring Tracy Margaret on the front does a nice job going over all that. The attendings here, some great attendings that we work with. Myself with 20 plus years in experience in taking care of patients with brain injury. Dr. Malone also sort of with a very long experience in taking care of people with brain injury. You get to work for 6 months with me on the inpatient unit. You get to work 6 months with Dr. Malone on the inpatient unit. The nice part is that we really, when the fellows come, we have them working at a higher level, so they're not sitting there writing H&Ps. I know that they've done a lot of that. The fellows have done a lot of that during their residency. They've become in a sort of a supervisory category with obviously with Dr. Malone and I supervising them. Really, again, we're trying to make that bridge between residency and what we hope for you to be is a great attending afterwards. We have Dr. Jamie Levine, who did her training, who did her fellowship training here, then was over at NYU for a bunch of years, and I had a chance and stole her back here to JFK, and she heads up the Extended Recovery Unit. We have Dr. Grease, who, amongst a lot of different things that she does, is the head of the concussion program, and you'll have a lot of opportunity to learn about concussion with her on an outpatient basis. We have Dr. Stephen Ascaldi. I think what Dr. Ascaldi does here is unique in the sense that all of his work is really just dedicated to spasticity, and you'll have a chance, ample opportunity to work with him in learning, botulinum toxin injections, learning backflow pumps, motor point blocks. These are all things that when the fellows leave here, they've had ample experience in and feel a high level of confidence in their abilities. We have Dr. Jokey, who's over at Rutgers, Robert Wood Johnson, who's doing trauma consults, and you'll get to spend time with her. So again, sort of real cross-section as far as clinical experiences, a real cross-section, everything from the trauma center straight through to all the outpatient. You'll get to spend time, outpatient time with me, also seeing follow-ups of some of the inpatients and also new patients that I get to see that are referred to me. But I think one of the things that you really want to look for in fellowship is an opportunity to see a lot of volume. And volume you definitely will get to see here across that whole spectrum. Research. So all the fellows are expected to be involved with a research project. I don't expect anybody to come here and have much research knowledge. I know when I started my fellowship, I didn't have so much research knowledge as far as or research experience in doing it on my own. What we do here is I really hold the fellows' hand. So during the first couple of months over the summer, when they're all busy thinking about their written examination or part 1 examination, we start talking about what their interests would be. I put some ideas out there about what might be good research topics. We come up together with a topic. Dr. Golden, who's one of our research PhDs, she sort of gives the stamp of approval that it'll be a good topic and that it'll be achievable. And we want to come up with a research topic by the end of the summer with the goal then of being able to do the research over those coming months, knowing by May, speaking in general, May, everybody's taking their oral examination. The fun part is that you'll have then a chance also to present your research in May at the Brain Injury Alliance of New Jersey annual meeting. I'm on their board of trustees. I make sure that the fellow has an opportunity to present there and an opportunity there to show off their research work. The timing always just works great, and it's been a great opportunity both for that organization and for the fellows. One thing I'd say is that I personally feel very invested in the fellows, and I see that your success is my success. So I want to see you to be successful over this year, and your success in the future. Over these last few days, I've been in touch with 3 of the fellows that we've had here over the past 8 years. I think one of the unique things that you'll get here is sort of a lifetime guarantee. As long as you'll need me, I'll be there to help make sure that your career continues to go well. So the traumatic brain injury model systems. The traumatic brain injury model systems, JFK, is one of the traumatic brain injury model systems programs. It's a competitive grant that people compete for every 5 years. We've been lucky enough to be a recipient of this grant. Exciting times. You can see our little New Jersey here, and us being there, that second dot. An exciting opportunity. I think it speaks about the quality of the research that we do, but also about the quality of the clinical care that we give and the quality of our program overall. Let's talk a little about the rotations over at JFK. So unlike when you're a resident, when you're doing clinical blocks and you're doing, let's say, months of spasticity or months of inpatient or months of outpatient, here what I do is on every day of the week, as you can see here on the schedule, and this is the schedule for this year, every day of the week is a little bit different, and that continues through the whole year. The nice part about it, I like that, and I think that the fellows have liked that, is that sort of you start doing spasticity in the beginning of the year and you continue doing spasticity, as an example, through the whole year, concussion through the whole year, inpatient through the whole year. I think it allows you to stay sharp the whole year in all the work that you're doing. You can appreciate here, so there's some inpatient in the mornings. We have a dedicated research time here. You have a outpatient spasticity and baclofen clinic and concussion clinic, and on Fridays you have your didactics. Come September, you'll have an opportunity to start working over at the trauma center with Dr. Joki. You also, during September, you spend Monday afternoons doing neuroradiology with one of our neuroradiologists, sort of a great experience. But lots during the week in between, right? So working with me on the outpatient, working over at Hartwick, the extended recovery unit, working at the trauma center. And that kind of continues along through the whole year with different opportunities there. Actually, in October, you get to spend the whole week over at the trauma center. Kind of really a dedicated dedicated trauma time, really working there, getting to know the trauma patients really well. The fun part is that those trauma patients are going to come over to the brain trauma unit, and you're going to get to see them there. Many of them will go over to the extended recovery unit, and you're going to get to see them there. They're going to follow up with the spasticity clinic or outpatient clinics, and you're going to get to see them there. You really get to see sort of not just a cross-section, but a continuum of patient care. So let's talk a little bit about the didactic lecture schedule. So you can see here on the top that it's Dr. Grease who does the didactic lecture schedule, 12 to 1 on Fridays, as you saw in the schedule. And so we use the Zaslow textbook, the Brain Injury Medicine textbook. I think it's the most comprehensive as far as covering the topics that we need to cover. I know Dr. Grease supplements the book chapters with lectures of her own. I give lectures. There's certainly lots of other lectures, but this is the official didactic lecture schedule. And you can appreciate sort of we run through the chapters, all the different chapters, and Dr. Grease is going to ask you to read some of this on your own, some of this, and she'll be talking about each of these chapters. But so much of the exam and information that you need, so just in general, comes for this, and that's how I picked these chapters specifically. Tried to pick ones, obviously, that go together nicely. The part you'll notice up here also is you get to a trach workshop, which is how we start off as part of the orientation for the fellowship. And then you can see also come there's a brain injury month where the residents do lectures in December, and you'll be participating in that and even giving one of those lectures. You can appreciate through the whole year. There's a really comprehensive lecture series. I couldn't end this introduction to our great program without mentioning Lisa Lopez. Lisa Lopez is the fellowship program coordinator, certainly a core part in making sure all the magic here happens, definitely the bedrock of our program to make sure everything happens the way it's supposed to happen. Make sure to be extra nice to her. Thanks so much. Well, I hope that gave you a good broad overview of our program. I'm sorry that you won't actually be able to join us here for the program. I wish you the best of luck in the interviews that are about to come up. Please don't feel shy to reach out to me or to my colleagues here at JFK, to our current fellow here at JFK. If you're looking to find more information, certainly reach out to me via email or phone. I'll be happy to talk. Because despite what COVID has done, we still want you to have the best experience possible and get to know as much as you can about our great program. Thank you.